can cóirle agus dúspáir a bhile mo chórón a thar anúil don na Chile dan bhartafar buas in dhé margheall ar COVID-19. Agus tá go dúirla genu agus caiimiid san teaseo coabrí le chéile sa dóis go ddíglinn na tragadí seo íslú agus is stapú san námata má róin. Coramagine in Sinn Féin ar muithe san úil don na Hebraní gohéirí na Hebraní Sláinte agus iad sinna lígatar in dína tasaí ag treidinéan an vírus COVID-19. Agus caiimiid fásta níos mó dhéanú dífisin gohéirí ó hiú cosanta pársanta tralú agus fásta caiimiid níos mó dhéanú dífiisiú a chaile bast margheall ar an vírus seo agus níos mó takeíart dífisin agus sin an foioi go gridin Sinn Féin agus go leasú a gcuinn seo go mé an stáitíigh ag céad fan céad a buí suas go dtí level da €5 agus a bhí €5. Can I begin this morning by expressing my deepest sympathy to the families and friends of the two further people that it was announced last night who lost their lives to COVID-19. As a result, all of us here need to work together. We need to try and minimise and to stop these tragedies in the coming period. I want to pay tribute to our health workers, Cancórlia, and all of those in the front lines who are fighting against COVID-19. Their courage, their selflessness, their dedication is both an inspiration and a comfort to the nation. These are trying times, Cancórlia, but to each and every one of them I say you have our gratitude, our support and our solidarity. Beyond expressions of support, we have to make sure that our health workers have everything that they need to do their jobs. We need to ensure that we utilise all available capacity within our health system, that we have sufficient ventilators and respiratory equipment, sufficient beds, including ICU beds, and that our frontline workers are protected. The lack of protective equipment for health workers, for carers and others is a cause of very real concern. We know that some frontline workers are taking to the internet to seek out their own resources, and the government have stated that home health workers do not need personal protective equipment. This cannot stand, and we need action now on PPE. I would urge all companies and individuals who have stocks of different PPE items to make them available to health workers, and I call on the pharmaceutical and food processing industries to donate any PPE equipment that they can. Along with the arrival of imported PPE, attempts must also be made to ensure that we have a reliable domestic production line of various PPE items to protect our supply chain in the case of external difficulties, and to guarantee our health staff that they have the protective equipment that they need to do their jobs to keep us safe and healthy. That is essential, Cancórlia. The changed criteria in respect of COVID-19 testing is causing alarm. Not just for patients, but it has also put huge pressure on GPs who are contacting patients to tell them that their tests are now cancelled. There must be clear communication when case definition changes so that confusion and panic can be avoided. The bill before us today is just one part of a series of things that need to be done to ensure that we keep our citizens safe. Absolutely everything we do right now must prioritise the welfare and the health of our citizens. This isn't a time for delay, it is a time for decisive action. Every worker and family must be protected and supported throughout this crisis, however long it lasts. Unfortunately, this isn't the current case. Despite the government's announcement on Tuesday, we see that many are still unprotected. Today and yesterday, tens of thousands of people left their families and went to workplaces which weren't safe. They are coming home in the evening with the fear that they are possibly transmitting the virus to their families. They are builders, factory workers, and those working in call centres, and many, many more. The nature of their work doesn't allow for safe physical distancing. I was contacted by the wife of a construction worker who I believe best sums up the dread that these families are currently living with. She wrote, "Me and the kids have been in all week, and my husband has to go out and to work every morning and risk coming back to his family. It's a disgrace. Something needs to be done." And we've received many more similar messages. Nobody should be living with the fear or the feeling that they and their children are being exposed to unnecessary and unavoidable risks. It is for that reason that we believe that everything other than essential businesses and services that can't be done from home should be put into suspension for a period, and we need to see further action in this regard, Cancórlia. This can be done. These workers can be sent home, they can be kept safe and they can be supported. To do that, we also need a proper income support scheme. Sinn Féin has proposed a model that would guarantee 100% of income up to €525 a week for workers and self-employed who are laid off during this crisis. The Government's proposals comes nowhere close to that and doesn't go far enough, and we will bring amendments to try and strengthen that today. These are people who have mortgages, who have rents, who have bills to pay, and €350 falls well short of what is needed to support workers and their families who have been laid off at this time. And in respect of those who are kept on the books, we are fully supportive of a scheme to support employers who are trying to keep going, and it is important that they keep going, but this must be targeted and not open to abuse. Employers should have to make up the rest of the 30% of workers' salaries. Under the Government's proposals, employers can record just as little as 1 cent towards their employees' pay and still avail of this scheme. That isn't good enough, Cancorlia. I'm glad that the Government has taken on board our proposals in relation to prohibiting rent increases. However, much more needs to be done to protect renters during this emergency. Renters who have a tenancy agreement who do not have a tenancy agreement must also be covered, and we must include provisions to ensure that people do not rack up a crushing level of debt in rent arrears. There is a solution: a real mortgage moratorium for landlords of renters who are unable to pay their rent, and in return, tenants must get real rent reductions and rent waivers. The Government must demand that the Central Bank and the banks play their part in making this happen. One clear action the banks could take is to waive the payment of mortgage interest during the duration of this crisis. The Government can't allow the banks to profit from this public health emergency as they plan to do currently. We bailed them out over a decade ago, and now they need to play their part in making sure workers and families are supported. We'll be putting amendments forward in this regard, and we are asking other parties and deputies to support them. The coronavirus outbreak has challenged our nation in an unprecedented and profound way. The phrase "Níneach go Carla Chiile," there is no strength without unity, has been used a lot over the last few weeks. To really understand the power and the meaning of that phrase, we only have to look at how our communities have responded to this emergency. Though there is great stress and worry, people are not only thinking about themselves, but thinking about their families, thinking about the safety of their neighbours and the wider community. People are out checking on their elderly and others at risk in their communities, making sure that they have enough food, helping with them with any difficulties that they could be facing. Volunteers are delivering care packages, making friendly phone calls and organising even outdoor bingo. There is an enormous amount of goodwill, of generosity, of selflessness and community spirit in our country. These qualities are proving to be some of our biggest strengths in the fight against COVID-19. As a people, we have truly embraced the principle of nobody is safe unless we are all safe, and we are all the better for it. The distances that we are keeping between each other are not spaces of isolation, fear or loneliness. They are lengths of compassion, of kindness, of solidarity. It is how we best protect each other, how we help flatten the curve, how we ensure our health service does not become overwhelmed, how we save each other's lives. And people need to continue doing what they have been doing. That is essential. Cancorlia, as we come together to battle the coronavirus, we must ensure that the Dáil sits throughout this crisis. We need solidarity in here, Cancorlia, but we also need scrutiny and accountability. We need to ensure that the Government works and that they're holding key sectors such as banking and insurance to account. And we also need to look at life after the emergency. The people voted for a new government only last month, and a new government must be formed. While there has naturally been a scaling down of talks in that regard, at some stage soon the result of the election will have to count. We cannot have a caretaker government in office indefinitely. Given the level of work to do, the timeframe is drawing ever shorter. Both Fianna Gael and Fianna Fáil have made a virtue of the politics of exclusion, and it's quite astonishing, even as we face a global pandemic and a national public health emergency, that exclusion remains their priorities. And I ask them to think about that, because I think it is a shame. A Fianna Gael, Fianna Fáil-led government will not deliver real and lasting change, and it will not provide the stability of government that we need at this time. Politics needs to change. A new government must reflect the demand of the people to do things differently. This crisis has shown us exactly why we need a government for change: a single-tier national health system, A home is a sanctuary and a right to a secure roof over your head, an economy that supports workers and families, real and robust social protection, all measures that Sinn Féin were calling for long before COVID-19 entered our lives. These developments, cannot be temporary. They can't be rolled back once the crisis subsides. Only a government for change will ensure that we do not go backwards. Only a government for change will continue to put workers and families first when this emergency is passed, and that is what we need now more than ever.